Hello friends, welcome to Dr. Nancy's Daily Bites. Today's topic is on cardiac output. Cardiac output is defined as the amount of blood pumped from each ventricle. It is really significant because it denotes the left ventricular output through aorta, and it's the most important in cardiovascular system because it denotes the rate of blood flow through different parts of the body. The expression of cardiac output is done by stroke volume, minute volume, and cardiac index. The stroke volume is the amount of blood pumped out by each ventricle during each heartbeat. The normal value is 70 ml in a range of 60 to 80 ml when heart rate is 72 per minute. The minute volume is the amount of blood pumped out by each ventricle in 1 minute. It is given by the formula stroke volume into heart rate. But we should know that in routine clinical practice, cardiac output refers to the minute volume. So, cardiac output is equal to stroke volume into heart rate. The normal value is about 5 liters per ventricles per minute. That is, it stands for both cardiac output as well as minute volume. Cardiac index is the amount of blood pumped out per ventricle per minute per square meter of the body surface area. It is nothing but the minute volume expressed in relation to the square meter of the body surface area. Cardiac index is given by the formula cardiac output divided by body surface area. So for example, if there is a 70 kg normal person and he has the body surface area of 2.06 square meters, then the cardiac index will be cardiac output of 5 liters divided by body surface area of 2.06, which is equal to 2.33 liters per minute per square meter. That is, the normal range will be 2.5 to 4.2 liters per minute per square meter for adults. There are various determinants of cardiac output. The first one is venous return, which is the amount of blood returned to the heart from different parts of the body. So it is directly proportional to the cardiac output and it depends upon the respiratory pump and the muscle pump. The respiratory pump is done by the respiratory muscles and the muscle pump denotes the muscles from different parts of the body. And the second determinant is the force of contraction, in which according to Frank-Starling law, the force of contraction is directly proportional to the initial length of muscle fibers before the onset of contraction. And it's directly proportional to the cardiac output and it depends on the diastolic period, ventricular filling, preload and afterload. So what is preload? Preload is the stretching of cardiac muscle fibers at the end of diastole just before contraction. And afterload is the force against which the ventricles must contract and eject the blood. The third determinant is the peripheral resistance. It is the resistance offered to blood flow at the peripheral blood vessels. Arterioles are called the resistance vessels and it is inversely proportional to the cardiac output. And the fourth determinant is the heart rate, which is directly proportional to the cardiac output. How do we measure cardiac output? By indirect method and direct method. Under indirect method, by using fixed principle, indicator dye dilution technique, thermodilution technique and Doppler echocardiography. Under direct method, ultrasonic Doppler transducer technique or the flow meter and ballistocardiography or the cardiometer. The factors affecting cardiac output are increasing in cardiac output is seen in anxiety, exercise and eating. Decrease in cardiac output is seen in rapid cardiac arrhythmias, heart disease, sitting or standing from lying posture. No change is seen in sleep and moderate change in temperature. The regulation of cardiac output is done by two things, that is heterometric and homometric. Under heterometric, the changes by altering the factors changing the end diastolic volume and changing the venous return plays the role. In case of homometric, the regulation without altering the end diastolic volume, increase in myocardial contractility, sympathetic stimulation and hormonal role plays the role. Thank you for watching. Subscribe for more videos.